This week, our regular public health update from the province turns its attention to addressing the recovery of the health system and tackling the backlog that has formed due to COVID-19 patients requiring a significant portion of the health system resources. ICU and hospital admissions have continued to trend downward, so Manitoba is still on track to remove the proof of vaccination requirement on March 1st and remove remaining health orders and mask mandates on March 15th, moving to recommendations instead of requirements. March 1st will also see the removal of the requirement for vaccination or regular testing for direct care workers and designated public sector employees. Individual businesses and facilities may still elect to keep some requirements in place, so the vaccination card and verification app will remain available. Visitors to healthcare facilities can also expect to see requirements for masks and physical distancing as they try to balance the need to prevent the spread of COVID within the vulnerable population with the importance of personal interactions to positive healthcare outcomes. We now join Health Minister Audrey Gordon, David Mateer, Health System Co-Lead for the Unified Health Sector Incident Command, and Dr. Brent Rusin, Chief Provincial Public Health Officer, for their updates.
Good morning, everyone. Thank you for joining us here today, and thank you as well to David Mateer, the Health System Co-Lead for the Unified Health Sector Incident Command, for being here, as well as Dr. Rusin, our Chief Provincial Public Health Officer. Our government is continually consulting with public health and other health officials to address the COVID-19 situation throughout Manitoba. Today, we're here to discuss a coordinated plan for the healthcare system to recover from the intense demands of the pandemic. COVID-related demands on Manitoba's health system continue to decrease following the pandemic's fourth wave. This enables Manitoba to prepare for a return to more normal activities and operations, including the resumption of many health services that have experienced delays or have been postponed over the past 2 years. This will increase the number of routine and non-routine emergency procedures that can be done by the health system as a whole. Currently, more than 500 healthcare staff have been redeployed across the province, and we will begin to transition these individuals back to their former programs and care units. Manitoba's Provincial COVID-19 Health Incident Command has developed a phased approach to resuming services, including surgical slates, diagnostic procedures, and outpatient or community services. To discuss this approach further, I will now pass it over to David Mateer. David.
Thank you, Minister, and good morning, everyone. My name is David Mateer, and I'm the Incident Commander for Manitoba's COVID-19 response. We continue to see positive signs across the healthcare system as the Omicron wave recedes. In the past week, we've had 12 COVID-positive patients admitted to ICU, including 0 yesterday. This amounts to the average of 1.7 patients a day. There were 106 COVID-positive patients in hospital this morning, which is up by 7 patients from yesterday. However, the number of COVID-positive patients in ICU has declined by almost 16% in the last week, from 38 patients last Thursday to 32 this morning. Since February 1st, the number of COVID-positive patients in ICU have improved by more than 40% since that time. While hospitals remain busy and hundreds of healthcare workers continue to be deployed to support activity, we're seeing a significant improvement in a number of key areas. We're mindful that as public health orders loosen, we may see a slight increase in COVID activity and patients needing our care. For the immediate future, the health system's focus will be on both maintaining capacity and supporting recovery. We know that the recent Omicron wave, combined with our province's high rate of vaccination, have improved our rate of local immunity. That has provided public health with an opportunity to loosen restrictions. It is also allowing the health system an opening to do the same. Earlier this week, we began with the first phase of loosening visitor restrictions at hospitals and personal care homes. We know that across the healthcare system, we're not back to normal, and we must maintain our capacity to care for COVID patients and to scale up services or scale them down as patient needs change. To support this planning, we're closely watching indicators that can show us what we can expect in the coming weeks. We're monitoring the key indicators of COVID transmission as they will determine the appropriate levels of support needed to address demand. Key indicators would include the number of patients in hospital due to COVID, as well as those in intensive care. As these indicators provide us with assurances around returning redeployed staff, we'll gradually reduce some COVID-related capacity. As COVID demands continue to decline, we can expect to see a continued reduction in the demand for our ICUs. As this happens, we will be able to sequence a return of many redeployed staff to their home unit or facility. There are approximately 500 health redeployed and reassigned across the province. We know that they want to return to their usual work, and we know that their ability to go back to their teams and units will allow for Manitobans to access services that they've been waiting for. We'll return them as soon as we are operationally able, and in line with a sequence or prioritisation that is being directed by our clinical experts to ensure that we're resuming the right services in the right order to meet patient needs. As we do, our capacity to perform non-COVID services will increase incrementally over time, and this will include surgery, diagnostics and outpatient services. This will occur in phases across the province beginning in the coming weeks. For the moment, our capacity in ICU remains at 124 beds. In the meantime, we continue to do the work needed to ensure Manitobans can access care in our most specialised facilities and increase our capacity to offer a wider range of services in a more timely manner. This includes the inter-regional transfer protocol, which has resulted in 294 stable patients being transferred to sites outside of their home health region in the past 3 months, and that includes 7 in the past week. While we recognise the concerns of affected patients and their families about the distance from loved ones, we also appreciate their understanding that these transfers remain necessary. We're also continuing to admit patients to the virtual COVID outpatient programme, or VCOP. This programme continues to provide home care to patients with COVID to help those who may require home oxygen and other supports during their recovery. To date, this programme has cared for 507 patients, including 11 patients currently, and saved approximately 3,729 inpatient days in hospital. The VCOP gives patients a safe alternative that allows them to be cared for remotely at home while freeing up hospital and staffing resources to care for inpatients. We continue to recruit and train staff to support necessary and valued work in critical care units and personal care homes. 30 nurses recently started the 12-week Critical Care Nursing Orientation Programme, and that was earlier this month. Further classes are planned for later in the year to incrementally improve our ability to support ICU patient counts, which remain well above pre-pandemic levels. There are also a number of individuals who have completed necessary work to become uncertified healthcare aides. These healthcare aides support the system, which include personal care homes. Unlike previous waves in the pandemic, we also now have monoclonal antibody treatments and oral antivirals, which are available for individuals battling COVID. The availability and administration of these treatments will remain a focus, with efforts underway both to increase awareness of the treatments and access to these treatment options. In addition to the indicators that we're monitoring, the capacity we're maintaining, and the staff that we hope to return to their home base very shortly. We'll maintain a number of preventive measures to mitigate the spread of the virus amongst our vulnerable patient populations. Our teams will continue to wear appropriate personal protective equipment. Our sites will continue to screen staff and visitors. We'll continue to require medical masks to be worn in all of our healthcare facilities, and maintaining physical distancing will continue to be a requirement for many interactions. Visitor guidelines will also continue to be reviewed over the coming weeks, and we work to balance the need to prevent the spread of COVID in our facilities with the important social connection that in-person interactions provide to patients and residents. While the proof of vaccination will no longer be a requirement for visitors to our facilities, it is not yet a return to normal for visiting within our facilities. Guidelines will evolve, appointments and visiting hours will remain in place, maximum numbers will continue to be identified, and again, masks will continue to be required. As we navigate these changes, we continue to ask Manitobans for your patience, understanding, and kindness during every interaction with our dedicated healthcare workers. To wrap up, the health system continues to respond to the needs of Manitobans. We continue to have capacity in our ICUs, and we do have medicine capacity in the system, though it often doesn't line up where the patients are actually presenting. We may be entering a new stage of the pandemic with loosening restrictions, but the health system's message to Manitobans continues to be focused on encouraging Manitobans to reduce the strain on our workforce by making smart choices. And that very much includes getting vaccinated and getting your third dose as soon as you're able to. Vaccines significantly reduce the risk of ending up in our hospitals, which will not just help you, but also many others, by allowing our health system to return to more normal operations. So at this time, I'll turn it over to Dr. Rusin. Thank you.
Good morning. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. I'd like to start off with presenting an update on our modeling. And so we've discussed in the past, we monitor a number of indicators through public health. We've come accustomed to those type of indicators that we see. None of them have been more important than that strain on the healthcare system. And so if we move to the first slide, we'll see here hospital admissions modeling leading up until mid-March. And so we can see here that this is trending in that right direction. We see a peak in early January, and that continued downward trend moving forward. If we move to the next slide, we'll see a similar trend in ICU admissions. Again, as we expect, this peak is later than the hospital admissions. This is a lagging indicator compared to hospital admissions, but we see that same downward trend in ICU admissions. So again, moving in that right direction. So these are the projections, among other indicators that public health continues to monitor very closely, giving us that confidence to continue on our plan to loosen restrictions in Manitoba. So of course, Manitobans can be assured that public health continues to follow these indicators quite closely, and will continue to update Manitobans as necessary. We know that in the past things have changed quickly, and so we rely heavily on our excellent epidemiology and surveillance team, who's been providing their expertise throughout this entire pandemic. And so their work and the work of the entire public health team has really put us in this position to continue to move forward. And those teams certainly have my gratitude. I'm quite proud to be part of those teams, and we'll continue to rely on their expertise as we enter this transition phase. So I want to remind Manitobans that proof of vaccination requirements will be removed in public settings effective March 1st. We've heard from some venues, some businesses that they're interested in keeping that proof of vaccine beyond that date. And so we can confirm that the Manitoba immunization card and the Verifier app will be available beyond March 1st for those who still want to use that. As Manitoba's plan to continue removing restrictions goes forward, we'll be removing that requirement for proof of vaccination or recent test negative results for designated public sector workers, also effective March 1st. So that includes education, childcare, healthcare workers, and other designated positions. So we know these coming weeks are a transition period. We are moving from public health rules to recommendations. We've always known that these rules were in for a temporary amount of time, always in the least restrictive fashion. And just like at other times where we've added restrictions or removed restrictions, there's many Manitobans with different perspectives on what that means for them. So we know that this will be a difficult time for many as we transition out of these public health restrictions that have been in place for very long. But again, remind Manitobans to be kind to each other, to be compassionate to others. We know this is going to be a difficult time, but as we see from that modeling, we are trending in that right direction, and we'll continue to watch those numbers very closely. So thanks again, and I think I'll pass it back to the Minister.
Thank you for that. As Dr. Roussin and Dr. Mateer stated, we continue to see positive trends throughout the province. Now is the time to prepare for a return to normal. On March 1st, the public health orders will no longer require proof of vaccination. And as well, in a letter going out today, signed by all regional health authority leaders and SDOs, I'm pleased to state that effective March 1st, direct care workers in Manitoba's health service delivery organizations will also see the removal of regular rapid testing or proof of vaccination requirements. Vaccination and testing requirements will also no longer be required for designated public sector employees, including education and childcare workers. And I just want to state that this pandemic has taken a significant toll on all Manitobans. Together, we can look forward to a coordinated and cautious plan to recover from the intense demands that COVID-19 has placed on our health system as well. Thank you all for doing your part and practicing the fundamentals that we've said so many times here in this press conference and on social media. And I encourage you all to continue to practice those fundamentals. Thank you again for joining us today. We look forward to your questions.
I have a question for Dr. Roussin. Dr. Roussin, was that a recommendation from health officials that the requirement for vaccination or testing be lifted for people who are working with vulnerable residents?
Well, we've said many times, our recommendations come in many forms and continually. So we're looking at those numbers. We support the move forward with the loosening of restrictions. The specifics of our recommendations are, like I said, take many forms, but public health is recommending the moving forward with the loosening of the public health restrictions.
And that includes people who work with seniors, people in hospitals, that sort of thing. Am I understanding this correctly?
Well, we have a number. That's certainly the move forward. What we're dealing with here. We know that we've seen this large Omicron wave. We know that a significant proportion of Manitobans are protected through vaccine. Many of them now protected through 3 doses, which continues to be available to people. So at this point, looking at the numbers that we're facing, we have recommended the gradual loosening of restrictions.
Minister Gordon, we've seen obviously recently that people are quite upset with the restrictions that are in place. We've heard virologists say that there is likely going to be another variant. if things turn around, how do you handle that? How do you address that? We've seen the anger from people recently. If we do have to put restrictions in place again, how do you handle that?
So, as Dr. Rusin mentioned, we continue to look at the evidence and the data, and I just want to pause to thank the epidemiologist and the public health team, including Dr. Rusin, for the incredible work that they have done over the past 2 years in terms of bringing forward evidence that we can use to make informed decisions. So we'll continue to look at hospital admissions, ICU admissions, and make decisions based on how that is trending. At this point, as we've stated today, they're trending downwards, which is why we're moving towards removing the PVC and lifting many of the restrictions that we've been under for 2 years.
And we've heard from quite a few doctors, healthcare providers, and advocacy groups that aren't comfortable with the way these restrictions are being removed. What's your response to that?
My response is that the decisions have been made based on the evidence, and we encourage those facilities to work very closely with Shared Health as well as their regional health authorities to identify what their needs might be and what their issues might be around removing the restrictions. It's about working together, and we're stronger together, and having those discussions and finding ways to make the system work efficiently and to provide the care that Manitobans expect and deserve to receive. I don't know if Dr. Mateer wants to address that as well from the health system perspective.
Yeah, well, absolutely. Just to add, thank you, Minister, to add to both the Minister's comments and Dr. Rusin's, the guidelines that we're seeing now from public health and the scaling down or easing of those has been discussed at both the incident command with our experts there and also the leaders of the healthcare system provincially. And so there is alignment in what we're attempting to achieve through public health orders and the way in which the healthcare system will respond to the needs of patients and also to align with public health orders.
And what about the plan for scaling up surgeries and procedures? We know, once the system gets back the 500 people who have been redeployed, is there a plan yet for how the surgery backlog and procedures are going to be handled? Is there going to be increased hours for surgical units? Is there a deal yet with Sanford Health and Fargo? Like how much detail is already in the works? Like how much do you know about what's going to happen once the 500 people are back to work?
So I'll let Dr. Mateer answer part of it, and I'll do part of it as well. So our government has made a commitment to provide Manitobans with regular updates related to the work of the Diagnostic and Surgical Recovery Task Force, and you will be receiving an update very soon. With regard to your question about Sanford, the agreement has been signed, and we continue to move forward in discussions with their officials as well as our health officials to design a pilot phase for that agreement to move forward. And I'll let Dr. Mateer talk about surgeries.
Yeah, thank you very much. I can't really comment on the Surgical and Diagnostic Task Force and the strategies there in terms of the backlog, but what I can say on behalf of the Incident Command is that we have a plan for scaling down critical care, which is ICU beds. We have a plan for returning to operations in acute care facilities. And we associated with all of that, of course, is human resources, and the plans dovetail with that. We've also got a plan for restoring community and continuing care services. Most of those plans will be coordinated, and some of them, particularly for surgery, will be led from a provincial level, but certainly in conjunction and collaboration with all of the regions, and particularly around the restoration of community and continuing care services. Those will be most likely regionally led and coordinated by the province. But we do have a plan for reducing the number of critical care beds. There are triggers and processes in place to make sure that we do that systematically. And at the same time, we have a plan for reintroducing services that have been paused and building up services such as surgeries to their pre-pandemic levels. So that's in place. The question around, well, what do we do if if we have to build up again, that's almost like the reverse of what we're doing now. So we're planning for the systematic restoration of operations, and those have priorities in terms of, for example, the surgeries that would be performed first, those that would restore first, and then sequentially move through that list of priorities. At the same time, we have the ability at any time to start to reverse that plan to scale up critical care if required. But all of those service levels are linked, from critical care, acute care services, and community and continuing care services, and of course supported by the underlying human resources plan.
All right, thanks. We'll go to the phone now.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from CJOB, Clay.
Hello, can you hear me now?
Yes, we can.
Yeah, Dr. Wilson, I know you can't speak for the city of Winnipeg, but when the mask mandate does come to an end on the 15th of next month, are you still highly recommending transit users, people who use the bus in Winnipeg, to keep their masks on?
And so when we're moving forward from public health restrictions to recommendations, part of those recommendations will be for for people to in indoor public places that distancing isn't possible, to one, stay home when sick, sanitize hands, and consider wearing a mask in those places if distancing can't be maintained. This is even more important for people who are at higher risk of severe outcomes. So we are moving from those requirements to recommendations. So everyone's going to have to do, a bit of that risk assessment.
Is that the same sort of advice you're sending out to general employers around the province? I mean, every company is going to have its own set of rules, but are you still strongly advising people to keep their mask on, even in the office place?
I think, again, it's going to be that assessment. If you're indoor, public place, and distancing can't be maintained, then wearing a mask is another way of adding protection. And so employers, individuals will need to consider how that fits best with their operations.
From the Winnipeg Sun, Ryan.
Hi. I guess you mentioned off the top, talking about resumptions of services. I was wondering if you could maybe specify what sort of services are being resumed right now.
Yes, well, I can tell you the planning has identified priority areas. So what we're trying to do is much the same as I mentioned earlier on, was looking at the right services in the right order. So our clinical experts have determined with consultation both at the provincial and regional levels of the sequence of priorities. So what we will find is that we'll probably prioritise the most complex and major surgeries, for example, ahead of other services and programs that will be restored. However, it won't be in isolation, so there'll be some concurrence between provincial major programs such as surgery and regional programs such as community and continuing care. But I can tell you that we have prioritised the facilities and the types of surgeries. For example, Health Sciences Centre, St Boniface, Grace, Brandon, Victoria. And so we have a list of those facilities and the services that will be providing along with cancer surgeries that form our priority list that will guide us through this re-establishment of our usual operations.
Okay, thanks. And my follow-up, I guess just in terms of the backlog, how long do you anticipate it'll take to kind of get through that to maybe make it more manageable?
So the Diagnostic and Surgical Recovery Task Force is working on the plan to address the backlog. As I mentioned previously, our government has committed to regular updates, and we will be bringing forward an update very, very soon. We are in the process of awarding the RFP to create the waitlist management system that is desperately needed to identify what the true number of diagnostic and surgical backlogs is. And so we will bring forward a plan very soon, and you will hear from the task force shortly.
From CBC Radio Canada, Anne Louise.
Hello, I was wondering, maybe for Dr. Rusin, if you have any information about variant BA2.
So with BA2, this is the subvariant of Omicron. We have not seen significant levels of transmission in Manitoba at this point. There's suggestion that this is more transmissible than the original strain of Omicron. I'm not seeing a lot of evidence regarding that it's more severe. So we're continuing to follow these numbers. We're still sequencing a significant proportion of our cases. We just haven't seen a lot of BA2 at this point.
Okay, thank you. And I have understood that you will continue to do updates on the backlog of surgeries, but it is your last update on the COVID situation?
The question is if it's our last update on the COVID situation?
Yeah, exactly.
Updates may change in the next few weeks, but bulletins will continue, and press conferences will be held as deemed necessary.
From CBC Manitoba, Jill.
Hi, good morning. Dr. Rusin, what are you seeing with pediatric trends with respect to COVID cases, hospitalizations, ICU admissions? What can you say about that?
So we see overall with case counts, we're seeing a decline overall with case counts in children and in adults. Of course, we're limited now with a lot of the rapid testing that doesn't necessarily get reported. I can let Dr. Matier speak to some of the specifics in the healthcare setting, but the same thing, we're seeing very little demand on the healthcare system, including hospitalization and ICU related to pediatric patients.
And yeah, I can comment that we track both and trend both adult ICU admissions, COVID and non-COVID, both, as I say, for adults, but also for pediatrics. And we're not seeing an increased demand on the healthcare system from pediatrics at this time.
And will Manitoba expand PCR testing with so few tests being done, but access still so limited right now?
What we want to do is continue to have our testing strategy evolve, and so we really are moving towards testing for clinical purposes. So those people who are at risk of severe outcomes, those in older age groups, those with underlying medical conditions, we want them to be tested as soon as possible because there's treatments available, but those treatments, the window of opportunity is quite small. We need to diagnose people within 5 days of symptom onset. But we're not looking to expand availability of capacity at the population level. We're doing it now at the clinical level.
From the Canadian Press, Steve.
Hi there. I'm wondering if you could expand on the decision to no longer require healthcare workers and teachers and other frontline people to be vaccinated against COVID-19 or undergo rapid testing.
Well, I mean, I think this is just all part of the move forward. We've seen the large Omicron wave. We have a significant proportion of the population protected now through vaccine, and many now with 3 doses that continues to be available, which we want anyone who's certainly it's at increased risk of severe outcomes to get that 3rd dose as soon as possible, or any dose that you're eligible for. And we knew that this was not going to be in place permanently. None of these public health restrictions were in place permanently, and with we're seeing the trends now in cases. It was that decision to move forward with removing proof of vaccine in public, but at the same time to link that to the other proof of vaccine requirements.
And my next question is for Ms. Gordon. Is the government going to do anything to support venues and business owners that wish to continue to check for vaccine status or have mandatory mask use indoors when the province lifts those mandates? As you know, a minority of people are very angry anytime they're forced to put on a mask or show proof of vaccination to enter a venue. And what is the government going to do to ensure that these businesses are not left on their own against these people?
So I want to assure and reassure the business sector that our government will be there walking side by side with them during this transition period. We will continue to have discussions with the various sectors about what their needs are, as Dr. Rusin mentioned. The QR code will still be available if business sectors want to require that at their place of business. And we will continue to talk to them about what their needs are around PPEs and around enforcement. And I will continue to have those discussions with my colleagues in Justice and the other departments to ensure that the business sector is supported going forward.
From CTV Winnipeg, Michelle.
Hi, Dr. Rusin. You said that you heard from businesses who wanted to keep this. I'm just wondering, how many? Obviously, there were a lot, enough to keep this program going. What did you hear from them, and what was the discussion?
And so, yeah, I don't have a good figure on how many are interested. I've just heard from a few that were inquiring whether the QR code would still be available moving forward because they did want to continue with this. So we haven't had much, not through public health, discussion with these businesses. We just wanted to, reassure everyone that that QR code and the Reader app is still going to be available should any business want to still utilize that.
Minister Gordon, what sort of help would you be providing to people who may want to upgrade their ventilation? It could be, in their homes, in their business. If people aren't coming in wearing masks anymore, ventilation is one way they could make their spaces safer.
So again, we have many business support programs in place currently, and my colleagues in the other departments continue to have discussions with the various business sectors about what their needs are. And our government is, as the Premier has said many times, that we're very much a government that wants to listen. And we want to work collaboratively with our business sector and ensure they are able to provide the services they were providing before the pandemic. So it's moving forward in a collaborative way, working closely to identify what the needs might be and how we can support them.
From the Brandon Sun, Karen.
Good afternoon. More of a question here. You were saying that there were hospitals that have been prioritized for surgeries, and of course Brandon is on that list. I just want to know if there was any kind of surgery that is being prioritized above all the others for our Brandon's hospital.
Yeah, thanks very much for the question. The detail of it, we're still working through. We have that overarching plan, the specific types of surgery that are carried out in those prioritised list of facilities are where our focus lies. Within those facilities, there are multiple types of surgeries that we'll look at how they're prioritised also. So a little bit premature for me to be able to answer that question right now. Thank you.
Okay. And also, you also, of course, we're talking about scaling down critical care as COVID wanes, but just wondering, some questions have been raised about whether or not we should have more redundancy just in case there's a public health crisis or another variant. Is there a plan in the works as we scale down from this current wave?
Yes, absolutely it is. And we're at the moment, Shared Health is actually looking at precisely that, what that definitive number of baseline critical care beds should look like. And that is being incorporated into our plan. So it's very, very unlikely that we would go back to the original baseline of 72 beds. And we're working on exactly what that number ought to look like. And we'll be scaling down to that number, which will increase the number of critical care beds in the future.
We now return to the news conference theater.
We've got time for a couple more questions.
Minister Gordon, will lifting the requirement for vaccination or testing for frontline healthcare and critical or people in working with vulnerable populations, will that help in any way with addressing the surgical backlog or getting back to normal? Like, what's the benefit of allowing people not to have to test, or people who have not decided to work because they don't want to do either? I mean, is this going to have any benefit to getting back to normal?
Well, what has happened, Carol, thank you for your question, is that we see the evidence that the numbers are trending downwards. And so we have to, Manitobans have done their part. In my last press conference, I went through the number of individuals that have first dose, second dose, and now their booster, which we refer to as a third dose. And so we have to loosen these restrictions to allow Manitobans and individuals in healthcare facilities to have that flexibility to be able to establish guidelines and protocols that Dr. Mateer has mentioned today. And this is, as these individuals begin, the 500 individuals, to return to their units and their clinical programs, it will certainly help for us to restart those surgeries. And Dr. Mateer's talked about the prioritization list that we have, and bring in some normalcy and bridging some divides that have been created throughout this pandemic. And that can only be a good thing. And we want to do it in an empathetic way. We want to be compassionate and kind, and to remember that everyone has had an experience with this COVID pandemic, and how do we heal some of those wounds. So most definitely it's about returning to a state of normalcy where we can continue to return to normal operations. Individuals are receiving the care that they need, the surgeries that they need as quickly as possible. I look forward to that.
And is there going to be any outreach? Like, how are we going to be working with staff who are, fully vaccinated and are concerned about people coming back into the workplace and working with vulnerable people who haven't been vaccinated or tested?
I'll also let Dr. Mateer answer, but we have had discussions at the senior level. So with the CEOs, the clinical leadership teams, today you will see a memo go out from all those facility leadership. They were in full agreement with the plan going forward, and we've asked them to work very closely with their staff, to listen, to reassure the staff of the steps that are being taken to keep them safe. And we will continue to listen and hear from the staff about what their concerns are. And I know those site leads will be working very closely with them as well.
Thanks, Minister. Not much more to add to that, actually, other than to say it was very coordinated and collaborative in terms of the steps to be taken at the senior level. And as the Minister referred to, there'll be a memo going out today. Local leaders in the regions will be listening to staff and working with human resources as to what that means for their staff and addressing their particular issues as they arise. But it's coordinated at multiple levels.
How will these changes affect the vaccination campaign? If more people have their third dose and now vaccines are required to do a lot of things, any changes to the vaccination campaign in terms of maybe powering down super sites or that sort of thing?
We'll be looking at that over the next few weeks, but vaccination is still our way out of the pandemic. We're not out of the, we're not fully out of the fourth wave yet. And so we will continue to advocate and encourage Manitobans to get their third dose. If they haven't received their first and second dose, to do that as well. But we will be looking as a vaccination implementation task force led by Dr. Reimer at what needs to be done over the next few weeks. Many individuals have been redeployed to that team. So we'll look at whether that needs to be scaled back, but we will still continue through our communications campaign to encourage vaccination going forward.
And patients
We'll do last question.
Okay. For patients who are stable and are still being transferred out of the region to other regions, recently one of those patients did contract COVID and died, and I'm just wondering how much longer will patients need to be transferred so far from home, and is that a priority to address in getting back to normal?
The inter-region or inter-facility protocol is around really identifying the right environment for the patient to receive the most appropriate care. So it's appropriate care, appropriate environment. And so that's really nothing new in terms of the healthcare system, either here or anywhere else actually in the world. Once a patient does not require acute care or that level of care, then there are alternatives that are explored. The clinical team will establish what those needs are and try to match those to a facility within the healthcare system. So that approach and caring for the patients and ensuring they get the proper care in the right environment, I don't think will change, and we'll continue to do that. Obviously, it's not desirable for patients to be moved far away from home, and that is an issue that we recognise, and we appreciate the understanding of families and patients and residents as we go through this in being able to maintain patient flow in our system. But to answer your question, I don't think that by in principle that process would go away.
All right, thank you very much, folks.